Good afternoon and welcome to this wonderful afternoon Committee on Health and Human Services. Committee Secretary, will you please call roll?
Dahlia. Here. Edgeworth. Here. Gonzalez. Here. Goulding. Here. Gray. Here. Hafen. Hibbets. Here. Hunt. Here. Jackson. Koenig. Here. Nadim. Wynn. Here. Ornlicker. Here. Chair Brown May.
Here. Thank you. Please mark our members present as they arrive, as we do have members that are everywhere at this time in session and are presenting bills in other committees. So welcome officially to Monday, March 31, 2025, the Committee on Health and Human Services. As a reminder, please silence your electronic devices. If you wish to testify today, sign in at the table. When testifying, make sure to turn on your microphone, clearly state and spell your name. Members of the public may provide comments or testimony on a bill either in person or telephone. To do so, you'll dial 888-475-4499. Today's code is 896-3462-9462, and then press the pound sign. Meeting agenda and committee information is available on Nellis or the YouTube channel. Public comment will be taken today at the end of our meeting. As a reminder, always courtesy and respect in all of our interactions today. Committee members will also be using their laptops and other electronic devices. Please don't take that as a sign of insult or discontent, as they're looking at lots and lots of things. Our agenda today, we have a lot going on, and so to give you the lay of the land so that everyone can prepare, first we're going to start with our work session, and then we're going to go in and we're going to take our bills a little bit out of order. So we're going to start with Assembly Bill 484 will be our first hearing, then we'll go into 482, and then finally we'll hear 438. Okay, just so you have an idea of how it's going to work. Yes, thank you. So with that, we will move into our work session. We do have 4 items on work session today. As a reminder, it's not customary for us to take testimony or rehear bills during the work session. We may invite a witness. I do know that we probably will refer to legal today. And we will first start with Assembly Bill 234, which requires Medicaid coverage for screening for certain forms of cancer. And we'll turn this over to our committee analyst, Mr. Davis.
Thank you, Madam Chair. Davis Florence for the record. Assembly Bill 234 requires Medicaid coverage for screening for certain forms of cancer. This was sponsored by Assemblymember Anderson and was heard on February 24th. AB 234 requires the Director of the Department of Health and Human Services to include in the state plan for Medicaid coverage for the screening of lung cancer and prostate cancer and all evidence-based methods of screening for colon cancer. There is an amendment submitted by the Nevada Cancer Coalition, which proposes to replace colon with colorectal in subsection 1B of section 1. Thank you, Chair.
Thank you. Members, are there any questions? Seeing none, I'll entertain a motion to amend and do pass Assembly Bill 234.
So moved.
Motion by Vice Chair Wynn, second by Assemblymember Hunt. Is there any discussion on the Assemblymember Edgeworth?
Thank you, Chair. Well, I very much appreciate the conversation I had with the Assembly member who brought the bill, and I am certainly opposed to cancer. I do wish that it said evidence-based for prostate and lung, just as it does for colorectal cancer. So I am going to be a yes today, but I reserve the right to be a no.
Thank you. Members, any other discussion on this motion? Okay, all those in favor, please say aye.
Aye.
Any opposed, nay? Hearing none, motion carries unanimous. And we'll give the floor assignment to Assemblymember Anderson. Thank you. Next on work session, Assembly Bill 244. Mr. Davis.
Thank you, Chair. Davis Florence for the record. Assembly Bill 244 enacts prohibitions relating to the use of disposable foodware containers containing polystyrene foam by certain food establishments. This was sponsored by Assemblymember Considine and was heard on February 28th. AB 244 prohibits a food establishment with 10 or more locations doing business in this state from using disposable foodware containers made wholly or partially from polystyrene foam. A willful violation is subject to a civil penalty not to exceed $1,000 for each violation. Beginning on January 1st, 2029, all food establishments will be prohibited from using disposable foodware containers made from polystyrene foam. Assemblymember Considine proposes the following 3 amendments. First, she would like to replace the term food establishment with food dispensing establishment throughout the entire bill. Second, replace in subsection 2 of section 3, $1,000 for each violation will now be $100 per day that there is a violation. And third, change the effective date for sections 1 through 4 and section 6 to October 1st, 2025. Thank you, Chair.
Thank you. Members, are there any questions on Assembly Bill 244? Seeing no questions, I will entertain a motion to amend and do pass Assembly Bill 244.
So moved.
Thank you. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Assemblymember Gray.
Madam Chair, I'm going to vote yes, get it out. I do have some questions though going forward, so I want to reserve my right to change my vote later.
Thank you. Any other members' discussion on this motion? Assemblymember Hafen.
Ditto.
Thank you. Anyone else? Okay. I will now entertain a motion to amend and do pass with those 2 discussion points on the record. And all in favor say aye. Aye. Any opposed, nay? Thank you. Motion passes unanimously. We'll assign the floor statement to Assemblymember Considine. Next up is Assembly Bill 266, making revisions relating to breastfeeding. Mr. Davis.
Thank you, Chair. Davis Florence for the record. Assembly Bill 266 makes revisions relating to breastfeeding. This was sponsored by Assemblymember Gonzalez and was heard on February 28th. AB 266 requires the Department of Health and Human Services to post resources related to breastfeeding on its internet website. This includes a fact sheet about available Medicaid coverage and community resources for lactation support. Additionally, the department must develop and carry out a public education program to increase awareness about lactation, including its health benefits and ways pregnant people and parents can connect to lactation support. Finally, this bill prohibits a place of public accommodation for denying the full and equal enjoyment of the place because a person is breastfeeding a child. Assemblymember Gonzalez submitted the attached amendment that proposes to remove Section 7, which makes a violation of the provisions of this bill a misdemeanor, and second, to add Assemblymember Brown May as a primary co-sponsor. Thank you, Chair.
Thank you. Members, any questions? Okay, seeing none, I would like for us to defer to legal. I do know that we had an amendment that was received from an interested party. It was accepted by the member, but then further discussion, there was some conflict. So I wonder, Mr. Nels, if you could speak to that. Thank you.
David Noss, LCB Legal for the record. Thank you, Chair, for the opportunity to clarify the intent and scope of the bill. Like the Research Division, Legal is nonpartisan staff and is therefore not endorsing or opposing this piece of legislation nor any other measure, only to clarify the scope and intent of the bill. The bill does not change or affect the ability of places of public accommodation required by law to have a minimum age requirement from enforcing that minimum age requirement. To provide as an example, a bar or casino is still authorized to and required by state law and potentially by local ordinances to prohibit entry into and remove from the premises any minor, even if that minor is breastfeeding. The bill does not create the right for a minor that is breastfeeding to enter into a bar, casino, or other place of public accommodation with a minimum age requirement, and an adult is not discriminated against when the child is with the adult that is breastfeeding is removed from the location when the child is removed because of the minimum age requirement. The reason why we're putting this on the record as legislative history as opposed to the amendment is because discrimination based on age is already within the ability for the Civil Rights Commission to enforce and to add additional language in to create a carve-out specifically for breastfeeding without addressing such a carve-out for the discrimination based on age could create a conflict and a discrepancy in the law that could lead a court to interpret them to be doing different things when we're really not trying to. We're trying to keep the existing law in place, that a minor is not allowed in a place where they are prohibited from going to by law. Thank you, Chair.
Thank you for that clarification. Members, any questions? Okay, seeing none, I will entertain a motion to amend and do pass.
Second. Don't give me the floor statement.
Motion by Assemblymember Gray, second by Vice Chair Nguyen. Any discussion on the motion? Assemblymember Hafen.
Thank you, Chair, and I do want to thank the co-sponsor for the amendment. However, I understand legal's interpretation, but I've been in this building long enough to know that things get challenged in court. And my opinion is I think that it would be good to have the other amendment in there just to clarify it so that not only the legislative intent is in there, but then it is actually in statute. So at this point in time, I will be a no. Hopefully before it gets to floor, I can get to a yes. Again, no disrespect to legal counsel. I've just seen things go to court where one attorney says one thing and another says another. So I'll be a no for right now.
Assemblymember Koenig.
I also will be a no, but I expect to be able to get over the concerns I still have by the time and expect to vote yes on the floor.
Thank you, Assemblymember Edgeworth.
Ditto.
Thank you. Any other? Assemblymember Hibbets.
I ditto the ditto.
Thank you. Okay. With that, all those in favor say aye. Aye. Any opposed say nay. Nay. Would you, if you don't mind, raise your hands. The nays are Assemblymember Hafen, Assemblymember Hibbets, Assemblymember Edgeworth, Assemblymember Koenig, and that is all. Thank you. Motion carries. We will give the floor assignment to Assemblymember Gonzalez. Thank you, Chair. Thank you. That leads us to Assembly Bill 284. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 284 requires the Director of the Department of Health and Human Services to seek to establish certain rates of reimbursement under Medicaid for certain devices to treat epilepsy. This was sponsored by Assemblymember Brown May and was heard on March 10th. AB 284 requires the Director of the Department of Health and Human Services to include under Medicaid a reimbursement rate for a vagus nerve stimulation therapy device that is greater than or equal to 82% of the cost of the device, and establish a reimbursement rate for any replacement part for such a device that is greater than or equal to 80% of the cost. These rates must be separate from and in addition to the reimbursement rates to the medically necessary care of implementation of such a device. Assemblymember Brown May proposed an amendment that establishes a reimbursement rate for the procedure of implanting or repairing a vagus nerve stimulation device that is greater than or equal to 82% of the cost of the procedure. Thank you, Chair.
Thank you. Members, any questions on this measure? Seeing none, I will entertain a motion to amend and do pass. So moved. A motion by Vice Chair Nguyen. Second? Second, thank you. Any discussion on this motion? Seeing none, all those in favor say aye. Aye. Any opposed, nay? Motion carries unanimous. Thank you. I'll take that floor statement. Okay. Thank you for your hard work on this work session today. With that, we will move into our next order of business. We will open the bill hearing on Assembly Bill 484. We will welcome our Assemblymember Hunt to the table to do our presentation. You may take your time, begin when you are ready.
Good afternoon, Chair Brown May, Vice Chair Nguyen, and fellow committee members. I am Linda Hunt, and I have the honor of representing District 17 in North Las Vegas. Thank you for allowing me to present Assembly Bill 484, which is a committee bill we recently introduced. This bill adds new information the Department of Health and Human Services is required to collect and compile into a database for healthcare providers with the intentions of allowing us to better understand our current healthcare workforce to address provider shortage in a more meaningful way. So I'm going to give you a little background information. As we know all too well, this state is suffering from severe healthcare provider shortages. For physicians to nurses to mental health professionals and emergency medical personnel, every corner of this state feels the impact of these shortages, with our rural and frontier counties experiencing the worst of it. One tool that allows us to craft impactful legislation to address these shortages is adequate data letting us know which provider types are in the greatest need. But also with patient groups are suffering, also it lets us know what patient groups are suffering the most. This bill seeks to add to that tool belt by bolstering the healthcare providers' data that is collected. With that, I will now briefly discuss AB 484. I will go through the bill. Okay, it's to provide a bit of context. Existing law requires DHHS to maintain a database of information on healthcare providers practicing in Nevada. This includes the type of license, race and ethnicity, specialty, and where the providers primarily work. You can see the whole list of existing items that DHHS collect in Section 1. This bill proposes adding 4 new data points that must be collected, which includes the sex of the provider, any other jurisdiction where the provider holds the same type of license, whether the provider utilized telehealth, and also the types of patient the provider serves. This includes newborns, children, adolescents, adults, senior citizens, pregnant people, veterans, incarcerated people, people with disabilities, people who speak languages other than English, and recipients of Medicaid or Medicare. So that concludes my presentation, Chair, on the bill, and I stand ready for any questions from the committee.
Thank you for your presentation, and thank you for taking on this charge of handling a committee bill presentation. So really well done. Members, are there any questions? Go ahead, Assemblymember Hibbets.
Thank you, Chair, and thank you, Assemblymember, for presenting this bill. I have a question, and I apologize if I missed it during the interim. What importance is the sex of the applicant?
Chair, I would like to pass that on to the expert we have here, Julie Peak from Public and Behavioral Health. There she go.
Thank you. Welcome, Ms. Peak.
Expert was very kind.
Thank you.
But Julia Peak, for the record, Department of Health and Human Services, through you, Chair. So sex is an important just indicator. For example, if people are just trying to understand the accessibility of a certain provider in the community, they may look for a number of things. For example, if I'm looking for a provider, I might want another female, depending on what type of service I'm looking for. So not only is this going to help us look at the demographics and services within a geographic area, but it also might be an opportunity for me if I'm looking for services for my children, or if I'm looking for services for myself, to pick somebody based on their, in this case, gender, sex. So that's the reason for that one. Certainly just another indicator to help us understand the dynamics of the service provider.
Thank you, Ms. Peak, and thank you, Chair, for the question. I appreciate it.
Great. Members, any other questions? Okay. Wow, this was really well done. Thank you so much. All right, we'll ask you to step back. At this time, we will take testimony in support. If anyone is here in support of Assembly Bill 484, please come forward here in Carson City or in Las Vegas. Seeing no movement. AVH, is there anyone on the telephone line who would like to offer comments in support of Assembly Bill 484?
Chair, the public lines are open and working, but we have no callers to offer support testimony at this time.
Thank you. Go ahead.
Sure. For the record, Carrie Harrington, Nevada Cancer Coalition. Thank you for hearing this bill. I happen to be here. I love this bill. We know we're very short healthcare providers across the state, especially in oncology. So we support.
Thank you for your comments. Thank you. At this time, we'll move into opposition testimony. Is there anyone here who would like to offer opposition testimony on Assembly Bill 484? Please come forward here in Carson City or in Las Vegas. Seeing no movement in either location. AVH, is there anyone on the telephone line in opposition of Assembly Bill 484?
Chair, we have no callers to testify in opposition.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Assembly Bill 484? No movement here in Carson City. Going once. None in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 484?
Chair, we have no callers to testify in neutral.
Thank you, AVH. At this time, we will invite our bill sponsor back up. Do you have any closing comments? No, she is waving us off. Okay, so we will close the bill hearing for Assembly Bill 484. Thank you so much. Okay, opening next item on agenda, we'll open the bill hearing for Assembly Bill 482. And we will invite forward our bill presenter for 482. She on her way? Thank you. We have officially opened the bill hearing for Assembly Bill 482. We will welcome our very own Assembly Member Taurus Fawcett to the table. You are welcome to take your time. Please begin whenever you're ready.
Thank you. Good afternoon, Chair Brown, May, Vice Chair Wynn, and committee members of a hardworking committee here in the legislature. I'm Assembly Member Selena Torres Fawcett for the record, and I proudly represent Assembly District 3 in Las Vegas. Thank you, Chair, for allowing me to present AB 482, which is a piece of legislation that is being introduced by this committee. We recently presented an important bill before this committee to establish the Right to Contraception Act. And this bill continues to make contraception as equitable, accessible, and comprehensive for all Nevadans as possible, regardless of their income, gender, or language. So a little bit of background. Last legislative session, I brought AB 383 from the 82nd legislative session, particularly regarding Medicaid reimbursements for healthcare providers for contraceptive services and covering costs for a language translation for contraceptive medicine. According to Planned Parenthood, the United States is at a 30-year low in the rate of unintended pregnancies and at a historic low in the rate of pregnancies among teens. This is largely because of expanded contraceptive access, which empowers young people to be the main driver of decisions relating to family planning, career, and pursuing education. While we gave pharmacists the ability to prescribe contraceptives in 2021, we can expand the number of providers by ensuring pharmacists are reimbursed at the same rates as other family planning providers. Critics may say that this law is unnecessary in our state, that we have already done more than enough to ensure Nevadans have the care that they need, but as it stands, more than 180,000 low-income Nevadans live in contraceptive desert areas without reasonable health care. The goal of this piece of legislation is really to ensure that all Nevadans have access to language translation services when they are receiving reproductive health care at all. Everybody deserves to know, to understand the level of care that they're being provided. Unfortunately, I have heard far too many stories of my students translating for their parents so that they know what's going on at the doctor's office. This piece of legislation seeks to ensure that Nevadans are reimbursed for language translation services. That the providers are reimbursed for language translation services through Medicaid. So at this time, I don't think I need to really walk through the bill. I think it's pretty straightforward, but at this time I'll go ahead and open it for any questions. Thank you.
Thank you. Members, any questions? Okay, seeing no questions, thank you so much for being here. We'll ask you to step back. At this time, we will open up testimony in support of Assembly Bill 482. If anyone is here in support of Assembly Bill 482, please come forward You're welcome to fill in the chairs. Please state and spell your name for the record. You'll have 2 minutes. You may begin when you're ready.
Good afternoon, Chair and Committee. My name is Sabrina Schnur, SABRINA-SCHNUR. I'm here today on behalf of the Nevada Primary Care Association. We are the state's FQHCs, federally qualified health centers, and we just wanted to throw our hat in support as well. Thank you.
Hi, Chair members. My name is Denise Lopez, and I'm with Reproductive Freedom for All. I'm here on behalf of the 60,000 members we have here in Nevada, and I'm in strong support. I'm here on a personal and professional reasons. I was one of the kids that used to translate for their parents and for community members, taking them to hospitals. I also served as transportation, driving to take people to doctor's appointments. I was not equipped to translate. I should not have been the person in those offices. Many times it was very intense conversations that a young person should not be having. And so that's why I'm here in support. I want to make sure that people have the right translation for medical terms so that they are fully able to understand what is being said to them and can make informed decisions about their medical care. Thank you.
Hi, I'm Caroline Mello Robertson, CAROLINE and I'm a lobbyist with Planned Parenthood Votes Nevada. And I actually worked on a bill in 2017 that did a lot of what is in this bill that's fixing. And I realized that as I was looking around at the committee, none of you were here then, so you don't remember that. But just recently, the state decided to invest in expanding access to contraception, and I'm proud to have been a part of doing that. But we did, at that time, took out some things that at the time the fiscal situation was rough, and one of them was vasectomies being covered without copay. And that's what's in this bill. I think it's really important to remind folks all the time that reproductive health care is for everybody, and that male responsibility is important. I know that at the time there were a lot of folks that testified that they knew that their hormonal birth control was going to be without copay, so they could use that, but their husband wanted a vasectomy. They couldn't afford to do that, right? So this change would be life-changing for those folks. I also think it's critically important to lift up what Denise just mentioned, but just to remind folks that really all care, but reproductive health care is the kind of thing that you want to make sure people can have in their own native language so they can understand it. It's not a revolutionary thought. A lot of states do this, and our state should too. So I'm really excited that Assemblywoman Torres brought this bill forward and brought forward the other bill and really wants to expand contraceptive access because we badly need it. Thank you.
Marco Rauda, MARCO, RAUDA, representing Americans for Contraception. Want to thank the chair and the committee for listening to this bill. Also want to thank Assemblywoman Torres for bringing this bill forward. We've been working on this for a little over 2 years now. This was a bipartisan bill when it passed, and in 2023, for that matter, the Senate minority leader at the time gave a great floor speech. We decided to split these bills just because we thought it'd have a better chance for the governor to sign it. So we're hoping that he does this time around with your support as well. Thank you.
Good morning. Is it morning? No, afternoon. Sorry. Good afternoon, Madam Chair and members of the committee. Sarah Adler, SARAH-ADLER, with Silver State Government Relations Day today, representing the Nevada section of the American College of Obstetricians and Gynecologists. And ACOG is in strong support of this bill and greatly appreciates the sponsor for bringing the bill. ACOG has a committee statement called Permanent Contraception, Ethical Issues and Considerations. And one of the conclusions, the results of that is, and I quote for you, whenever appropriate, vasectomy should be discussed during patient counseling as an option with fewer risks and greater efficacy than female permanent contraception. And to put it in the words of the doctors for whom I work, vasectomy is cheaper and safer. So they're very much in support of the vasectomy, enabling that as a service. Their question and their hope is that this bill improves the ability of hospitals to receive reimbursement for the contraception that they provide. They could provide 12-month contraception at birth, but they're having a challenge in getting that funded right now, so hopefully this bill will address that. And then ACOG is 100% in favor of the language access components of this bill. So thank you very much.
And good afternoon. Thank you. Is there anyone else here in support of Assembly Bill 482? Seeing none here in Carson City and none in Las Vegas. AVH, I'm going to re-say this telephone line because I think I said it incorrectly when we started. So just for clarification, if you would like to provide public comment or testimony on a bill, dial 888-475-4499. And then today's meeting ID is 873-637-46071, and then press the pound sign. AVH, is there anyone on the telephone line who would like to offer support on Assembly Bill 482?
Chair, we have no callers to testify in support at this time.
Thank you. At this time, we'll move into opposition. Is there anyone here who would like to offer testimony in opposition of Assembly Bill 482? Please come forward here in Carson City or in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line in opposition for Assembly Bill 482?
Chair, we have no callers to testify in opposition.
Thank you. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in a neutral on Assembly Bill 482? Seeing no movement, this is a very still room here and in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 482?
Chair, we have no callers for neutral.
Thank you, AVH. At this time, we will welcome the bill sponsor back for closing comments.
Thank you, Chair. Assemblymember Torres Fawcett, for the record, I just wanted to make it clear, too, on the record, that we are also losing out on federal money by not participating in this program. There is federal money to match what we are providing for language translation. And so this would allow for us to get federal money that we are currently not receiving and that other states are receiving. So it allows us for the price is pretty meager because we would be able to get those federal funds as well. So thank you so much. I'm happy to meet with anyone that has any additional questions on this bill.
Thank you. At this time, we will close the bill hearing on Assembly Bill 482. Thank you so much. Okay, Assemblymember Dickman, we are happy to open the bill hearing for Assembly Bill 438. Please feel free to come forward to the table and take your time. You are welcome to start as you are ready.
Thank you, Madam Chair. That went much more quickly than I expected. Good afternoon, Chair Brown May and committee members. I'm Jill Dickman, and I represent Assembly District 31 in Washoe County. I really appreciate you allowing me to present ABA 438, which makes changes to the regulatory structure of non-emergency medical transportation. Joining me at the table is Vaughn Hartung, who is the chairman of the Nevada Transportation Authority, and Bobby Sullivan, who is the program manager for emergency medical services with Health and Human Services. Non-emergency medical transportation is a critical service that helps individuals who need assistance getting to medical appointments without the urgency of an emergency situation. Typically, the vehicle is a wheelchair or gurney-equipped van. Currently, these services are regulated by the Nevada Transportation Authority. This bill proposes to transfer that regulatory authority to the Division of Public and Behavioral Health. The Health Authority will be responsible for permitting non-emergency medical transportation services and cannot charge more than $200 for an annual permit. The Health Authority is already responsible for the permitting of ambulances, air ambulances, and firefighting vehicles, so it streamlines this permitting process to include non-emergency medical transportation with other medical transportation services, and that is true except in Clark County. Additionally, the bill requires drivers of non-emergency medical transportation vehicles to report any observed abuse, neglect, isolation, abandonment, or commercial sexual exploitation of vulnerable individuals. Chair Brown May, there is an amendment. and we'll be going over that. It will transfer the regulatory authority of these services in Clark County to DPBH instead of the Southern Nevada Health District. I think there was some confusion because, as they will explain, there is not much reference to non-emergency vehicles in statute, and I think they conflated emergency and non-emergency. So anyway, I'll now turn it over to these experts to walk you through the reasons this just makes sense and walk you through the bill.
Thank you. Good afternoon, Madam Chair. Vaughn Hartung, for the record, the Chairman of the Nevada Transportation Authority. That is VAUGHNHARTUNG. Before we get into the presentation, what I'd like to do is just tell you a fast story, which really was the impetus for this. There was a transport that was happening for a patient from Reno to the eastern side of Nevada who was sent home on hospice. During that transport, the patient passed away. The driver did not stop, and I believe that they contacted their dispatch. They told them to keep going. When they got to the eastern side of the state, the coroner had no idea what to do because they didn't know where the patient passed, and they didn't know what time the patient had passed. DHHS contacted us, and we said, we have no authority over the health and well-being of that patient. That's outside of our purview. So the other piece that I'd like to include in this is non-emergency medical transport, unlike every other thing that we regulate, which would be tow, limousines, charter buses, moving and storage, TNCs, which would be Uber and Lyft, etc. Autonomous vehicles, they're all called out in statute. They're all inclusionary. Non-emergency medical is through exemption. It is not mentioned in NRS 706 anywhere. So hence the issues that LCB ran into, they're looking for statutes to change. There are none. In fact, non-emergency medical is only mentioned in NRS 433A 160, which, by the way, we do not administrate, sub 2B and 433A 330 sub 2A. Only places that non-emergency medical transportation is mentioned. So it was a bit of a conundrum for them. So what I'd like to do just real briefly is run through, I thought I knew how to do this, run through our presentation. This will only take a moment, I promise. The Nevada Transportation Authority has been charged with the responsibility of overseeing transportation within Nevada. We oversee NRS 706, 706A, 706B. 706 is major transportation and all forms of transportation like intrastate. So charter buses, limousines, shuttle buses, etc. 706A is TNCs. 706B is autonomous, and then one final is 712, which is moving and storage. What we do is we give out certificates of public convenience and necessity, or MV numbers, which would be contract carriers. Currently in the entire state, we have 10 CPCNs and 2 MV contract carriers. Authorized vehicles are 182, and we have 365 to 400 permitted drivers. Those drivers do have to undergo a criminal history background check, as all drivers do within the state of Nevada that are administrated through the Nevada Transportation Authority. This slide basically goes through our application and our insurance process, ensuring that the applicants have financial stability, and so we deal with that and the fitness to carry passengers. There's also, you'll notice that we do have the process of applications can take multiple years because of petitions for leave to intervene, PLTIs. That's a very, very unusual situation. I don't know whether you're familiar with that, but I'm happy to answer questions in just a few moments if you would like some more background on PLTIs. The next slide is the inspection process. We inspect the vehicles annually. We are only inspecting for road fitness. We are not looking at any of the scenarios that would hold down a wheelchair, a gurney, the mounts, the restraints. That is not within our purview. That's not within 706. And then the driver permitting, again, we go through a fingerprinted background check that has to be turned into the FBI to determine the fitness of the driver and to ensure that there are no exemptions. And then I'll turn it over from there to DHHS. Sullivan.
Good afternoon, Madam Chair. Bobby Sullivan, for the record, Bobbie Sullivan. As Mr. Hartung stated earlier, this conversation was the result of a patient who was transported from the west side of Nevada to the east side of Nevada. And when the patient passed, the crew was advised to stop and they'd either notify law enforcement or go to the nearest hospital or call 911. They did not. There, as we have found through the discussion, there is no regulatory oversight under NRS 450B, which governs emergency medical services. Yvonne, you want to go to the next slide? Our process, I hear there is, all of our applications are online. We've completely streamlined the process so that we can have increased efficiency. We do issue permits for the ambulance and fire services. Our application process for completed applications can be same day, within 30 days, depending on if all the information is included, whereas Mr. Hartung spoke to, his application process can take up to 18 months. We also oversee non-emergency secure behavioral transport services within the state. And again, same process, all online. We can expedite it much quicker. Go.
Amber Alert.
Continuing, we certify driver only, which in the rurals helps support the smaller departments who struggle to staff ambulances with 2 EMTs or 2 advanced EMTs. They go through the same process as a background. We also do the EMTs, advanced EMTs, paramedics. We are a participating member of the Nationwide EMS Compact.
It's very appropriate that we have emergency signals going off
That was
while we're
planned.
talking about non-emergency transport.
That was planned.
Pardon the interruption, but I'm sure it's going to continue to happen. So by all means, please go ahead.
Okay. We also inspect the ambulances. We inspect the providers. We also investigate complaints, and we oversee training and education. Go ahead. Go ahead. And this is okay.
Von Hartung for the record, VAUGHNHARTUNG, Chairman of the Nevada Transportation Authority. So this really is the analysis of what this sort of compiles. We treat non-emergency medical like any any limousine, not an ambulance, any limousine in the state. It is nothing more than passenger transportation for us. Again, we're only looking at the roadworthiness of the vehicle itself. 706 does not refer to or address any health-related issues. All contract motor carriers are subject to petitions for leave to intervene, which can draw the process out. And by the way, that process, so if a carrier says, I'd like to add 10 vehicles, that could be subject to a petition for leave to intervene. Most of the petitions that I have been the hearing officer on, in fact, all of them that I've been the hearing officer on, have been based on competition. And it's really more, this is my intersection, I want you to go sell newspapers somewhere else. And so it's very difficult, and in fact, I have ultimately denied them because in a competitive market, I don't see that the forces are anything more than what one would see in a growing market. So our final slide is our conclusion. The Department of Health and Human Services is dedicated to protecting public health, while the Nevada Transportation Authority is committed to ensuring the safe transportation for residents and visitors of Nevada. We feel that this is a strategic alignment that will improve public service accessibility while prioritizing the health and safety of passengers who rely on non-emergency medical transportation, including the underserved rural communities in Nevada. We believe that this will actually grow those markets and make it easier for them to enter in, those carriers that want to enter into that market on a smaller cap. I am ready for any questions, and I have my staff in Las Vegas, my phone of friends. I have my Deputy Commissioner David Pasternak and my Chief of Compliance Desiree Main. Thank you, Madam Chair.
Thank you for the presentation. Members, questions? Assemblymember Ornlicker.
Thank you, Chair, and thank you for bringing this bill. You mentioned when you, Mr. Hartung, when you do your assessment for drivers that you do a criminal background check. So I'm curious, what criminal background will disqualify somebody? Are some things automatic, some depending? If you could just give us some information on that.
Thank you for the question, Assembly Member. For you through the chair.
Please go direct.
Thank you. So NRS 706-462 outlines that process for background checks. Criminal offenses that are violent offenders or some that are sexual in nature, those would be automatic offenses that would exempt them from being able to have a permit, and that's everywhere. That would be whether it's a limousine or whether it's a taxi cab. And by the way, we don't regulate taxi cab within Clark County, only outside of Clark County. So we look at those criminal background checks as a way that we can filter out those individuals that may not be quite right to carry passengers.
So for lower level crimes, marijuana possession, does that get looked at all?
Well, Von Hartung, for the record, Assembly Member, drug offenses could be, depending on what the drug offense is, but we're mainly looking for higher levels, Schedule I stuff. Marijuana would not be an extenuating factor that we would look at and say, no, you can't drive. That's drunk driving would be another issue that we would look at, so we would look at those DUIs. It's that kind of behavior that we're looking at.
Thank you. Members, any other questions? None. I do have one. Specifically under Section 6. So on page 6, Section 6 talks about, it calls out NRS 450B and jobs and day training providers, and it further identifies JDT providers as recognized in NRS 435. But I'm curious to know what about supported living arrangement providers, right? So specifically, we're talking about non-emergency medical transportation, but there are folks who have intellectual and developmental disabilities that live in residential settings that are often transported by their residential service providers. Oftentimes, they're served under a Medicaid waiver, right? And so I want us to be really clear about what is the provider that we're targeting and what are the exclusions relative to that, because we have adult daycare centers that are moving folks to potentially medical appointments, right? There's a whole group of support agencies that are out there working to support our most vulnerable populations that are doing that type of service. I want to be really clear that we are targeting, what exactly are we working on? So can you speak to supported living arrangements?
Madam Chair, Bobby Sullivan, for the record, for this portion of it, what we would be looking at is the safety of it, not necessarily expanding that permitting process. We recognize that there are those vehicles out there that should be looked at not only from the mechanical portion of it, but the interior, to make sure that they can safely secure those patients and those residents.
And as a follow-up, if I may, Madam Chair, currently we don't regulate those types, Von Hartung for the record, we don't regulate those types of facilities. So as an example, when my parents, I moved them from Scottsdale to northern Nevada, when they could no longer care for themselves, put them in an assisted care facility, and the bus transportation, the shuttle bus transportation that was provided by that particular facility, that does not come under the purview of the Nevada Transportation Authority. So those would still remain exempt. I answered your question.
Thank you. You did, Mr. Hartung. I appreciate that, but it sounds like DHHS may have a different perspective, right? So I just want to be really clear.
Madam Chair, Bobby Sullivan, simply to look at this because of the infancy of this, with the bottom line of the safety of the patient. So if that's not something that would be part of the purview, we would go there. But again, we're just learning, because it's been such a short turnaround on this, of not knowing if those residents were secure. And we could work with the operators of those living facilities to go through that process, whether it's a separate designation to look at that.
Thank you. I appreciate that. I do have many more questions, and perhaps we could take this offline. I'd like to get into just the delineate what agencies we're looking for, and then what are the expectations for them to become compliant. I fully support, and I know this committee does, the safety and security of all of our patients or residents or participants, right? And I think that we have those different categories. So I think this has been a great hearing. The bill is phenomenal. I haven't seen anything to this degree prior. I just would like for us to not have an unintended consequence because we didn't walk it all the way through. I think really well done. Members, any other questions? No. Okay, at this point, I will thank you for your presentation. We'll ask you to go ahead and step back, and we will open up testimony in support of Assembly Bill 438. If you are here in support of this measure, please come forward. State and spell your name for the record. You have 2 minutes. Also in Las Vegas, if you are here in support in Las Vegas, please come forward to the table.
Good afternoon, Chair Brown May and members of the committee. My name is Tessa Laxalt Robinson, Robinson, and I'm here representing the Nevada Trucking Association here in support of AB 438. Thank you, Chair, for hearing this bill, and to the bill sponsor for bringing it forward. As an organization with members who operate under NRS 706, we concur that the chairman's position We concur with the chairman's position that non-emergency medical transportation carriers should be regulated by the appropriate agency, which in this case is the Department of Health and Human Services. This bill will ensure that these carriers are aligned with the proper regulatory framework, enhancing oversight, and ensuring that non-emergency medical transport services are provided safely and efficiently. Thank you.
Thank you. Seeing no one else here in support, AVH, is there anyone on the telephone line in support of Assembly Bill 438?
Chair, the public lines are open and working, but we have no callers to testify in support at this time.
Thank you, AVH. Is there anyone at this time? We'll open testimony in opposition of Assembly Bill 438. Is there anyone here in opposition of Assembly Bill 438? Carson City or Las Vegas? Seeing no movement, AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 438?
Chair, we have no callers to testify in opposition at this time.
We are moving at lightning speed today. At this time, we'll open testimony in neutral. If there's anyone here who would like to offer testimony in neutral in Assembly Bill 438, please come forward at this time. We have some movement. That is exciting. In Las Vegas. You may begin when you're ready.
Thank you, Madam Chair. My name is Brent Carson. I'm an attorney down here in Las Vegas. I represent several of the non-emergency motor carriers that appear regularly before the Nevada Transportation Authority. I've been doing this for nearly 2 decades. I've listened to the presentation. I've spoken to the NTA about this proposed bill, and while we agree with the intent and the understanding of the bill as written currently today to align the medical transportation, we believe that the bill as presented is not clear. I would like the opportunity, I understand that there will be an amendment to it to remove the language that relates to districts or divisions and get rid of the Southern Nevada Health District. But that's something that I think we need to view because what I think you hit the nail on the head, we just don't want any unanticipated consequences appearing from this bill without a full understanding of it. So with that in mind, I do understand the intent and the understanding of what the goal is, but I think I just want to be able to see it for myself without the confusion And there will be some areas within the bill that I have changes or suggestions, such as in Section 5 of the bill, where it defines what non-emergency medical transportation is. I think that right there is in need of a rework of what it is because it's confusing, just the term non-emergency medical transportations, but we are not medical providers at all. We are drivers. I don't think we should be lumped into a paramedic or an EMT or something like that. All we are a driving person from point A to point B. So I think that just needs to be further spelled out in the definition itself. So with that, I guess I heard a few of your members say that I would probably be voting yes, but on this bill. But I'd just like to see what the changes that Assemblywoman Dickman is presenting. So thank you for your time. If I'll have any questions, I've got here my clients here that are actual members of the industry itself to answer any questions if you have any, because I'm sure people don't really understand non-emergency medical transportation. It's a new concept. Thank you.
Thank you for your comments and testimony in neutral today. We appreciate you being here. Okay, AVH, is there anyone on the telephone line who would like to offer comments in neutral on Assembly Bill 438?
Chair, we have no callers to testify in neutral.
Thank you so much. At this time, we'll call our bill sponsor back up for any closing comments.
Jill Dickman, for the record. Thank you, Madam Chair. If it's okay, Ms. Sullivan has some answers to your question.
Thank you, Madam Chairman. I did my phone a friend. For clarification, that regulatory oversight wouldn't fall to EMS or 450 because of the other licenses they hold within the division. That would fall to them. So there would be no involvement from us on that part.
Thank you, Madam Chair. Vaughn Hartung, for the record, the Chairman of the Nevada Transportation Authority. And our intent with this is to eliminate Clark County. There should be no bifurcation whatsoever in that text, and that was the confusion. They just didn't know when the LCB looked at this, and the confusion, I believe, was solely centered on the fact that no place in the NRS 706 in the statutes is NEMT mentioned. And so they were looking for some nexus, and the only thing that they could find in our statute is NRS 706-745, which does call out all of those exemptions. So we do have, it's lengthy, but it's not lengthy. It's just basically eliminating everything that has to do with the Southern Nevada Health District.
Thank you, Chairman Hartung. I would hope that we don't eliminate Clark County, but maybe out of the bill. Thank you. Right, that.
Thank you so much, Chair. I really appreciate your indulgence in this closing remarks part and for your thoughtful questions. And I think AB 438 represents a proactive step toward improving healthcare accessibility and patient protection in Nevada. So I hope you will all support. And if you have any questions, contact any of us. Thank you so much.
Thank you. Thank you for your presentation today. At this time, we will close the bill hearing for Assembly Bill 438. Okay, members, that moves us to the next item on our agenda, which is public comment. To provide public comment online, you would dial, or on the telephone, 888-475-4499, and today's meeting ID is 873-637-4071. I will say that again. The meeting ID is 873-637-4671. 071. Is there anyone here who would like to offer public comment here in Carson City? Anyone in Las Vegas? Seeing no movement. AVH, is there anyone on the telephone line who would like to offer public comment today?
Chair, the public lines are open and working, but we have no callers to give public comment at this time.
Thank you, AVH. Members, that concludes our business for today. With that, our meeting is adjourned.